Hey there, everybody. It's your old pal, Mr. Taylor, and we're back with our second video. Today, we're going to be learning all about the movements at synovial joints. And as you can see, I had to put myself on the webcam here so that you can see all the movements of my synovial joints today. Hey, so I feel a little ridiculous doing this. You can see I had to get this goofy, like, gamer headset to put on so that you can hear me. I tried using the microphone on my laptop, and it just didn't work at all. So this is the best we're going to do. So anyway, with no further ado, here we go. All right, so movements at synovial joints. We have a whole bunch of different things that synovial joints can do. First one's called gliding, and this is basically what we see at planar joints, where we just have our bones sliding past one another. Mostly this happens, like I said, at planar joints, so you're seeing this mostly between the carpals and the tarsals, giving you like an extra range of motion. So like when you turn your hand sideways, there's little tiny minute movements that happen at the carpals. Same thing happens at the tarsals in your feet. Angular movements are by far the most common, and these involve changing the angles of your bones. The first one of these is called flexion, and flexion by definition is a decrease in the angle between the bones. So if here's my hand, if I flex my joints, I'm decreasing the angle between them. So here I am at a 180, and slowly I'm decreasing the angle until it's very small, and then that's it. So when you flex, you can flex your fingers, you can flex your wrist by bending your wrist like this. You can also flex your arm, of course. So here's my elbow joint, and I'm going to flex it, so I'm decreasing the angle. You can flex your shoulders by moving your shoulders forward. You can flex your knee, of course, by bending your knee. So basically it's bending, but generally flexion is moving anteriorly. So from the anatomical position, so if my hand's in the anatomical position like this, when I flex, I'm moving my fingers forward. When I flex, I'm moving my wrist forward. When I flex, I'm moving my elbows forward, my shoulders forward. The only exception really to this is your knee. Your knee, when you flex it, of course, moves backwards. Extension is the opposite of flexion. So like if I flex my fingers like this to make a fist, when I extend my fingers, I'm straightening them back out again. So extension is just returning back to the anatomical position. So it's increasing the angle of the joints. The third thing is called hyperextension, and this is just where you extend beyond the anatomical position. So here's my hands again. I can flex, I can extend, but I really can't hyperextend very much, but a little bit I can hyperextend. But my wrist, if you watch, I can flex my wrists, I can extend my wrists, and then I can hyperextend my wrists by moving them backwards. So thinking about like if you're carrying a tray on your hand or something, that's hyperextension. Some joints can do this, some joints can't, but any joint that can move back past the anatomical position is hyperextension. So to use my elbows as an example, I can flex my elbow, I can extend my elbow. I really can't hyperextend it. I can't really get past the anatomical position. But with my shoulder, right now my shoulder's flexed, and then I can extend it back to the anatomical position. And if I hyperextend it, it's like I'm reaching backwards. You can do the same thing with your hip. If you move your hip forward versus backwards, forwards are anteriorly is flexion, moving it back down underneath of you is extension, and then hyperextension is if you kick backwards. Okay, the next pair are called abduction and adduction. And as you can see, they sound very similar. So we usually say abduction and adduction. Abduction or abduction means to move away from the midline. So watch, I'm going to abduct my arms at the shoulder. There we go. We call that like a lateral raise. You can abduct your fingers. They're spreading. They're going away from the midline. You can abduct your wrists too by turning them outwards from the anatomical position. That's abduction. Adduction is the opposite. You add things together, so you move things together. So if these are my hands, I can adduct my fingers by doing that. I can adduct my arms, they're up, by dropping them down to my sides. I can adduct my legs by pulling them together. So like your groin muscles on your inner thigh, for example, are adductors, adductors, and they pull your legs together. Great. And the last one is called circumduction, and this means to move in a circle. So here's my wrist. I can take my hands and I can abduct or adduct, but I can also circumduct. I can move them in a big circle. You can do this with your neck too. So if you move your neck in a big circle, this is called circumduction. Same thing with your shoulder. You can circumduct your shoulder joint. Great. So here's some picture examples. So there's some gliding, exciting stuff. Here's some examples of the other movements that you can do, also very exciting. And here's some more examples of abduction and adduction at different joints. So you can see the abduction is spreading, and the adduction is pulling it back together. Circumduction, of course, moving in a circle. Okay, so that brings us to rotation. So there's two types of rotations. A rotation, of course, is like at a pivot joint or a ball and socket joint where we're spinning around an axis. Basically, when we look at rotation, there's what's called internal and external rotation. Internal rotation is moving something medially. External is laterally. So if I have my arms bent and I rotate my shoulders, my hands will come in towards my midline. Okay, so I'm pulling my hands in, but my whole arm at the shoulder is rotating. Okay, so that is an internal rotation when you bring your hands in. When you bring your hands out, like you're spreading them out, that's an external or lateral rotation. And we use this a lot when we study the muscles, so it's important to remember. So if you bend your arms at like a 90-degree angle, internal or medial rotation, external or lateral rotation. And you can do the same thing with your legs. Like if you bend your knee and you rotate your hip, you can make like your foot point out, or you can make your foot point in. When you turn your knee inward, it's medial, and when you turn your knee outward, it's lateral. Okay, so there's some rotation also at the neck, and this is just, of course, at a pivot joint. All right, now, special movements. These are really exciting. Elevation, depression. Elevation means to raise, depression, lower. So if you shrug your shoulders, I just elevated my shoulders. When I drop them down, I depress them. Mouth. When I drop my chin, depressed, elevated. Great. Protraction, retraction. To protract is to stick out, and retract is to pull back. So if you stick your head forward, you're protracting. If you pull it back, you're retracting. Same thing with your tongue. You stick your tongue out, you're protracting, pull it back in, you're retracting. Inversion, eversion. This is with your feet, and like you can't really see my feet, but if you imagine the sole of your feet would be like the palm of my hand. When you point the soles of your feet inward, you're inverting. So you're pointing them inward. When you point them out, you're everting. So think about this. You can like turn your feet kind of in or out. Think about it like if you're standing on a hill and the hill was like kind of tilted, right? You would kind of like turn one foot one way and turn the other foot the other way. So one foot would be pointed in and one would be pointed out. Or if you were skiing, for example, you might like turn your feet back and forth on skis. Dorsiflexion, plantar flexion. This is something that has to be done to the foot. So imagine my hand is a foot. When I pull my toe up, so when I'm like lifting my toe up so that my heel is down and my toe is up, that is called dorsiflexion. When you point your toe so that your toes stick flat out, that is plantar flexion. So like when you stand on your tiptoes. So the easy way for me to remember this, the back of your hand and the back of your foot is considered to be the dorsum. The sole of your foot and the palm of your hand are kind of like similar. So this is like the dorsum, or the back of your hand. The top of your foot is considered the back of the foot. So when you dorsiflect, you're basically pulling your foot up towards the dorsum. So you're pointing your toes like back up in the air, and you're putting your heel down towards the floor. When you plantar flex, you're moving the plantar surface down towards the floor and pointing your toes. So standing on your tiptoes. Supination, pronation. These are done with your hands, and if you've ever played hot hands, you've done this before. So if I said, hey, here's a bowl of soup, and I hand it to you, how are you going to take it? You're probably going to put your hands up like this. Like you're going to put your hands palm up and take the soup. You would hold a bowl with your hands up. You can't exactly hold a bowl like this, like with your palms down. That wouldn't exactly work. So when someone hands you soup, you'd be like, oh, thank you, and hold the soup this way. So this is supination. Pronation is switching it the other way. I don't know if you know this, but when you lay down on the floor, like if this is your floor and you lie down on it face down, you are in what is called the supine position. I'm sorry, the prone position. Ooh, whoops, messed that up. Prone position is face down, supine is face up. So depending on how you sleep, you'd sleep into one of those positions. Another way to remember that is like Superman flies above the world, so he's got face up, and prone would be face down. Okay. Another movement is called opposition, and you've probably done this a lot. If you take your hand and you touch your fingers together. By the way, thank you, dear, for coming into my video. That was great. This is opposition. You're opposing your finger to your thumb. Great. And here's some example pictures of those. So elevation and depression, protraction and retraction, some great modeling going on there. Inversion and eversion, dorsiflexion and plantar flexion. You can see how the dorsiflexion in this picture, the foot is pulling up, so toes up, heel down. Plantar flexion, we're going the opposite way and pointing our toe down, heel up. And then you can see the inversion and eversion. Inversion, your inside of the foot is going up. eversion, the outside of the foot is going up. And then when you look at pronation, supination, you can see when you pronate, your palm is going to be facing backwards. So from the anatomical position, you're going to turn it backwards or palms down. And then when you supinate, you're going to turn your palms forward or up for that. Great, so that's it for all the movements. Last little thing to talk about is the knee joint. And there's lots of joints in your body that are really interesting. The knee is kind of like my favorite, so that's why I picked it. I think it's really an interesting joint. It's pretty complicated, and a lot of people end up having like knee issues at some point in their life. So when you look at the knee, interesting things to know. If you ever feel your knee, and you can try this right now, if you feel like around your knee, there's a lot of muscles. You have quads, you have hamstrings, you have your calf muscles, and they all kind of come together right around your knee. And all those muscles help to kind of like tighten and strengthen up the joint. If you ever had Mrs. Lung, she loves to talk about her knee because she had a meniscus tear and she tore her ACL, and she does taekwondo, so she'll tell you all about her knee muscles. But basically, those muscles kind of help to like support it. So the more muscle mass you have, the more support you get to your knee. In addition to those muscles, you have what are called external ligaments, and these are around like the outside of the knee and basically kind of help to hold the exterior together. Most of these kind of make sense. Like, for example, on the front, on the anterior surface, you have what's called the patellar ligament that holds your patella and your tibia together. So you know where your patella is, it's your kneecap, and it goes down to that tibial tuberosity and helps to hold together the front of the knee. On the back, if you remember from way back in the first chapter, we said popliteal means related to the back of the knee. You have these popliteal ligaments, oblique and arcuate popliteal ligaments, and they kind of just crisscross across the back of your knee, and I'll show you what they look like in a minute. On the medial side, of course, we have the MCL, and that's where we get its name from, medial collateral ligament. And it is connecting your tibia to the femur. So that's just like a little band of tissue that holds the inside of the knee together. And on the outside, we have the lateral or fibular collateral ligament, known as the LCL. And that connects the femur onto the fibula. And so here's the whole point of these ligaments. If you think about it, you're setting up walls. So you have like an interior wall, an exterior wall, a front, and a back wall. So you have these four walls that all kind of surround the knee and hold it together so it's stable. If something were to like push in on your knee, so like let's say this is your leg, and something comes from the outside and pushes the knee and causes it to like buckle inwards, it would actually stretch the MCL. So the MCL keeps your knee from buckling in towards the midline, so it keeps it from going too far medially. The LCL does the same thing, except it causes it to not go too far laterally. So if something pushed outward on your knee, so it's trying to push out, the LCL would prevent that from happening. So guess what? If something were to try to push your knees inward, the MCL is what would break. So the most common way that you could break the MCL, there's actually two. One is like a twisting motion. Any type of twisting is really bad on the knee. And two would be that if anything tried to buckle your knee inward, that would cause the MCL to go. And the LCL would be the opposite for lateral movement. Inside of the knee, we have what are called the internal ligaments. And these help us to limit how much the femur can move. And so we have what are called the ACL and the PCL, the anterior cruciate ligament and the posterior cruciate ligament. And their names come from the fact that they cross. So the ACL is in the front, the PCL is in the back, they crisscross over each other. And basically the ACL keeps your knee from going too far anteriorly or hyperextending. The PCL keeps it aligned posteriorly, but since your knee bends posteriorly, we don't really break this as much. These two ligaments are really good as far as like if they get twisted, if they get like bent too much, they can break. So if something twists your knee and rotates it, either one of these can snap, but the ACL seems to be the one that breaks the most. All right, the meniscus, of course, we talked about this before. That's just like that pad of fibrocartilage. It's like a shock absorber inside of the knee. Kind of helps to keep it together so that you don't get a lot of like wear and tear from jumping. And finally, the bursa. And the bursa are just those little fluid-filled sacs that help to reduce the friction inside of the joint. These are the pictures of the knee, and you can pause this and take a look at all these different parts, but you can see the ACL and the PCL, how they cross. You can see the MCL and the LCL. You can see all the different ligaments inside of the knee. It's really very interesting. And so that brings us to these review questions. I don't have enough time to go over these answers right now, but what I think I'm going to do is I'm going to stick these into a related document where I'm going to have you guys answer these questions and then submit them so that I can check that you actually watched the video and you know what's going on. So go through and you can do these. There's some questions about the knee, and that's about it. So hey, thanks for listening and have a great day. Take care.